transplant immunosuppressive drugs prescribed to minimize risky. Cyclosporine. Kidney transplant immunosuppressive drugs prescribed to minimize risky. Glucocorticoids. Kidney transplant immunosuppressive drugs prescribed to minimize risky. First-gen/conventional antipsychotics used to treat positive symptoms of schizophrenia. Schizophrenia: chlorpromazine/thorazine, thiordazine/melarial, fluphenazine/prolixin, haloperidol/haldol. Hook them up to an EKG. More harsh med/first-gens increases likelihood of NMS/EPS extrapyramidal symptoms. Schizophrenia: chlorpromazine/thorazine. Why? Schizophrenia: first-generation conventional antipsychotics. Why? Schizophrenia: first-generation thiordazine/melarial. Why? Schizophrenia: first-generation conventional antipsychotics. Why? Fluphenazine prolixin. Why? Schizophrenia: first-generation conventional antipsychotics. Why? Haloperidol/haldol. Schizophrenia: first-generation conventional antipsychotics. Why? Second generation atypical antipsychotics. Your atypical treat positive and negative symptoms, helps decrease bizarre behaviors and depressive symptoms. Second generation atypical antipsychotics. Your atypical treat positive and negative symptoms, helps decrease bizarre behaviors and depressive symptoms. Schizophrenia: olanzapine/Zyprexa, risperidone/Risperdal, quetiapine/Seroquel, aripiprazole/Abilify. Second generation atypical antipsychotics. Your atypical treat positive and negative symptoms, helps decrease bizarre behaviors and depressive symptoms. With second generation antipsychotics/atypical, you have increased risk for metabolic syndrome and less likely for NMS/EPS because they are atypical. Be aware of what you're eating. Increased risk for cardiovascular complications, neurovascular complications, renal complications, and your weight. Olanzapine/Zyprexa. Why? Schizophrenia: second generation atypical antipsychotics. Why? Risperidone/Risperdal. Why? Schizophrenia: second generation atypical antipsychotics. Why? Quetiapine/Seroquel. Why? Schizophrenia: second generation atypical antipsychotics. Why? Aripiprazole/Abilify. Schizophrenia: second generation atypical antipsychotics. Why? schizophrenia. With all antipsychotics, you start at lowest dose and work your way up until you have reached the therapeutic blood level to decrease the risk of any of these side effects. Education for all antipsychotics, schizophrenia. Suicide for both and safety risk. Education for all antipsychotics, schizophrenia. They can take 4-6 weeks to be effective. Education for all antipsychotics, schizophrenia. Don't stop abruptly / both. Aripiprazole schizophrenia second generation atypical antipsychotics. Why? Education for all antipsychotics, schizophrenia. Report 10/NMS. Education for all antipsychotics, schizophrenia. Monitor for metabolic syndrome / more second-gen weight gain, can't control glucose, high BP, high lipids, risk for cardiac issues / stroke, heart attack, diabetes. Education for all antipsychotics, schizophrenia. Agranulocytosis, monitor SS of infection, WBC.
Yes, sir. How about decrease? Yes, sir. How about decrease?
Education for all antipsychotics, schizophrenia. Agranulocytosis, monitor SS of infection, decrease WBC. Agranulocytosis, monitor SS of infection, decrease WBC. Education for all antipsychotics, schizophrenia. Agranulocytosis, monitor SS of infection, decrease WBC 4500-11,000 per millimeter 3. Education for all antipsychotics, schizophrenia. Extrapyramidal symptoms, tardive dyskinesia, akathisia, dystonia/life-threatening in the neck. Treat EPS with cogentin and benztropine, benzo, and or lower. Education for all antipsychotics, schizophrenia. Extrapyramidal symptoms, tardive dyskinesia, akathisia, dystonia/life-threatening in the neck. Treat EPS with cogentin and benztropine, benzo, and or lower the dose or change meds. Anticholinergic effects, schizophrenia. Dry mouth, anticholinergic effects, schizophrenia. Constipation/anticholinergic effects, schizophrenia. Flushed skin but not sweating, very dry, anticholinergic effects, schizophrenia. Blurred vision, anticholinergic effects, schizophrenia. Photophobia, anticholinergic effects treatment schizophrenia. Suggest SF hard candy or gum sips of fluid. Give foods high in fiber, a fluid, still softener, raw fruits and veggies, greens. Wear sunglasses outside. Lithium. Bipolar therapeutic level 0.6-1.2 mg LY becomes toxic greater than 1.2 mg toxicity YNV abdominal pain in lethargy confusion muscles weakness tremors atoxia increased UO convulsions diet consideration daily weight strict eye and oi. Bipolar therapeutic level 0.6-1.2 mg suggest SF hard candy or gum sips of fluid. Give foods high in fiber, a fluid, still softener, raw fruits and veggies, greens. Wear sunglasses outside. Constipation/urinary retention. Suggest SF hard candy or gum sips of constipation, still softener, raw fruits and veggies, greens/urinary retention. Suggest SF hard candy or gum sips of fluid. Give foods high in fiber, a fluid, still softener, raw fruits and veggies, greens. Wear sunglasses outside. Lithium. Lithium-A bipolar. Toxicity 1.5-2.0 blurred vision, ataxia, tinnitus, persistent NVD. Lithium-A bipolar. 2.0-3.5 excessive output of dilute urine, tremors, muscular irritability, psychomotor retardation, confusion. Lithium-A bipolar. Greater than 3.5 impaired consciousness, nystagmus, seizures, coma, oliguria, anuria, arrhythmias, myocardial infarction. Lithium-A bipolar. Lithium-A bipolar. Toxicity, NV, abdominal pain, lethargy, confusion, muscles weakness, tremors, slurred speech, increased TO, convulsions, ataxia/drunk looking. Toxicity, NV, abdominal pain, Lithium-A bipolar. Diet considerations: continue to eat salt, decrease salt Y indices, risk for toxicity, daily weight, strict eye and a weekly therapeutic level check, labs frequently take med same time every day, no alcohol.
A sudden decrease in sodium intake, a component of salt, may result in higher serum lithium levels, while a sudden increase in sodium might prompt your lithium levels to fall.
Lithium-A bipolar. Diet considerations: continue to eat salt, decrease salt Y indices, risk for toxicity, daily weight, strict eye and a weekly therapeutic level check, labs frequently take med same time every day, no alcohol. A sudden decrease in sodium intake may result in higher serum lithium levels. Anticonvulsants Y carbamazepine/Tegretol. Bipolar therapeutic level SC4-12 mcgm La bone marrow suppressione. Anticonvulsants Y carbamazepine/Tegretol. Bipolar anticonvulsants, also known as mood stabilizers, can be given in conjunction with lithium to decrease the amount of lithium needed. Carbamazepine/Tegretol therapeutic level 4-12 mcgml bone marrow suppression. Anticonvulsants Y valproic acid/Depakote. Bipolar therapeutic level is 50-120 mcgm. Live photosensitivity, hepatotoxicity, bone marrow suppressione. Bipolar therapeutic level is 50- anticonvulsants Y valproic acid/Depakote. Bipolar valproic acid / Depakote therapeutic level 50-120 mcg/ml for mania side effects, photosensitivity, hepatotoxicity, bone marrow suppression, monitor for liver enzymes / PT may complain of back pain, nausea, anorexia, fatigue, jaundice, monitor for bone marrow suppression, CBC, low platelets. 4,500-11,000 per millimeter 3. Anticonvulsants Y valproic acid / Depakote. Anticonvulsants Y valproic acid / Depakote. Bipolar, monitor for serotonin syndrome. Anticonvulsants Y valproic acid / Depakote. Bipolar valproic acid / Depakote therapy. Anticonvulsants Y valproic acid / Depakote. Bipolar therapeutic level is 50 antipsychotic CSS. Antipsychotic SSRI antidepressant fluoxetine / Prozac. Bipolar monitor for serotonin syndrome. Antipsychotic SSRI antidepressant fluoxetine / Prozac. Bipolar antipsychotics SSRI antidepressant monitor for serotonin syndrome / sertraline, fluoxetine SE of SSRIs, weight gain, orthostatic hypotension, decreased libido, increased risk for GI bleed, suicidal ideation, avoid alcohol and OTC drugs / tell provider, do not stop abruptly. Serotonin syndrome bipolar. Shivering, neuromuscular symptom that is unique to serotonin syndrome. Serotonin syndrome bipolar. Hyperreflexia and myoclonus seen in mild to moderate cases, most prominent in the lower extremities. This can help differentiate from neuroleptic malignant syndrome, which would present with lead pipe rigidity. Serotonin syndrome bipolar. Increased temperature, not always present but usually observed in more severe cases, greater than 41 C. Serotonin syndrome bipolar. Vital sign abnormalities / instability, tachycardia, tachypnea, and labile blood pressure, up or down. Serotonin syndrome bipolar. Encephalopathy, mental status changes such as agitation, delirium, and confusion. Serotonin syndrome bipolar. Restlessness, common due to excess serotonin activity. Serotonin syndrome bipolar. Sweating, autonomic response to excess serotonin. This symptom can help differentiate from anticholinergic toxicity, in which the patients would present with increased temperature but dry to the touch. Serotonin syndrome treatment bipolar. 1 with cold med. Serotonin syndrome treatment bipolar. 2 stabilize vitals. Serotonin syndrome treatment bipolar. 3 cardiac monitoring. Serotonin syndrome treatment bipolar. 3 cardiac monitoring. Serotonin syndrome treatment bipolar. 4 IVF. Serotonin syndrome treatment bipolar. 5 supportive care. Serotonin syndrome treatment bipolar. 602 admin. Serotonin syndrome treatment bipolar. 7 benzos for sedation.